With bloodborne pathogens, what we're talking about are any sort of microorganisms that can get in the body and cause disease, and they're usually in the form, the ones that we're most worried about, in the form of viruses and bacteria. And bloodborne pathogens is something we do every year, and it's required by a lot of licensing and rules that we have to follow in various services. But we also want to understand bloodborne pathogens, and we want to go through it regularly, because if we understand how exposure happens, then we can minimize or potentially eliminate that exposure to pathogens just simply through good, careful personal hygiene, protective equipment, engineering and work practice controls, and some basic training. We all know what pathogens are. We all know, in a sense, how to protect ourselves from them. But in the work that we do, where we're often working odd hours and long hours and working through very difficult situations, we can have some very unhealthy habits that form very quickly if we're not careful and protect against those things. And in working with other people and in working in a lot of the services that we provide, we're always working with not just clients, but we're working with coworkers, we're working with community partners, social workers, court counselors, a lot of other folks out in the field that we come in contact with. There's always the possibility we can be presented with a situation where we do have some exposure to blood or other bodily fluids. And if we understand how those infections occur and how they're passed from one another, then we know how to protect ourselves, or better, how to protect ourselves and others that we come into contact with, and most importantly, our clients. The way infections occur is that the disease process starts when a pathogen enters the body. If there's enough pathogens to overpower the body's natural defense mechanisms, it can cause infection or lead to illness. And most infectious diseases that we're going to be concerned about, or most of the pathogens that we're concerned about, are viral or bacteria in nature. There's a couple of differences, and most people know these things, but bacteria is something that's everywhere. It's a self-sustaining organism, so it doesn't depend on us or other organisms for life. So it's everywhere. It's all over the table. It's all over your pen, all over doorknobs. It's all over your body. Most bacteria doesn't cause problems for humans, and in fact, there's some bacteria that can be very helpful for us. But there are some bacteria that can infect us and cause serious illness or pose some risks to us. And some of those bacteria that we're most concerned about, and particularly for you guys in residential settings, because of the close quarters that you're in all the time, it's a little more of a significant risk. And some of those things that we're concerned about are bacterial meningitis, and that's something that's been in the news a bit recently. I don't know if anybody has heard about it, but there's been a couple of college students that already this semester have gotten meningitis, and a couple of them have died. The most recent one was at Georgetown University, I believe, and they're really concerned about isolating that risk. So anybody that's had contact with the student that contracted meningitis, all of those folks are getting antibiotic treatment now, and they're concerned about it spreading because it's so easy to spread from person to person. Tetanus, we're coming in the time of the year where strep is a concern, and especially working in a residential setting where you're in close quarters. And we see that happen probably once a year, where at least one of our youth might get that. And then generally, if it's not contained, you'll see it go from person to person, and you're just kind of praying that it skips by you. But it'll go through all the kids. It'll go through all the staff if we don't get it contained. And then we have, working in some of our services, those horror stories that we come across where we have youth that have never had good quality, consistent medical care. So they come in the field, we link them with that medical care, and then they find out that they've been infected with some sort of bacterial STD, gonorrhea, syphilis, things like that. And as we're dealing with bacteria, historically, one of the benefits if you have a bacterial infection is that it can be treated with antibiotics, which serve to weaken or kill the bacteria. And if they weaken it, the goal is that it weakens it enough that your body's natural defense mechanisms can take care of it. So historically, antibiotics like penicillin and tetracycline have been enough to combat bacterial infections. But what we're encountering now is increasing number of strains of bacteria that are resistant to antibiotics. And I think everybody's aware of that, and there's some that are more prevalent than others. One of the ones that are very common is MRSA, and I assume everybody's heard of MRSA before. It's been around for a long time, but it's recently, in the last few years, increasingly resistant to antibiotic treatment. So one of the places where we're most concerned about MRSA and some other bacterial infections are places like gyms, where you have close contact with others. And it used to be you'd go in a gym and you could use all the equipment and you just wipe the sweat away and then use the equipment like you didn't think anything about it. But now when you go in gyms, there's usually antibiotics or hand sterilizers or hand sanitizers at every doorway. And you clean your hands before you go into a room or when you leave a room. Before you use equipment, you spray it down with antibacterial spray or wipes. And then when you're done with it, you do the same thing. But if anybody follows NFL, you know that the Tampa Bay Buccaneers last year had an outbreak of MRSA at their training facility. And if you think of the resources that an NFL team has and how carefully maintained that gym would be as opposed to the ones that we probably use, if it can happen there, it can happen anywhere. And we've had a couple of cases of MRSA that has broken out in some of our programs, and we've been very fortunate that we've been able to contain it. And it's one of those bacterial infections that can be range from very minor up to very, very severe. Unfortunately, the outbreaks we had have been very minor in nature, and we've been able to take care of them without spreading to other clients or staff. Viruses are different from bacteria, and as you all know, in that they are parasitic. They depend on other organisms to live and to reproduce. They cause a lot of different diseases, and many of those are very common. And they're very difficult to eliminate once they get in the body. There's no real good effective treatment for viruses unless it's a virus that we have vaccinations for, and we don't have that for a lot of the viruses that are out there. So your body's immune system is the best defense against any viral infection. Some of the viruses we're worried about, particularly in some of our services, like residential, are things like hepatitis, measles, chickenpox, meningitis, rubella, the flu, the rhinovirus, or the common cold are things that we're exposed to every single year. So those are the things we're most likely to encounter. If we do encounter any pathogens, our body's natural defense mechanisms kick in, and that's our first line of defense. Our skin works really well, but it's got to be intact to work. And even if you don't have cuts that you're aware of, you may have some micro abrasions that you're not aware of that could allow infection. Mucous membranes work similar to skin, but they're much more porous. They don't work quite as effectively as skin. So they trap germs and then force them out through natural body functions like coughing or sneezing. And when we talk about the mucous membranes, we're talking about eyes, ears, nose, throats, those areas. Much less effective than skin, and there are some germs that are able to penetrate the mucous membranes. And then once we have pathogens in the body, the immune system kicks in and fights germs with white blood cells and antibodies if those are available in the body. Some of the infections were the pathogens we're most concerned about, and when we talk about bloodborne pathogens, the three pathogens that were of most concern to us in the health field starts with hepatitis. And there's two types of hepatitis viruses that we're going to talk about. The first one is hepatitis B, and it's viral in nature, And hepatitis attacks the liver. So it can range from a minor infection to very serious. In more serious infections, it can lead to chronic liver disease, can lead to cancer of the liver, and if it's left untreated and it's severe enough, it can be fatal. One of the challenges with hepatitis is that you can be infected, it can be in the body for up to 6 months before any sort of symptoms appear. And once symptoms appear, they may appear to be flu-like in nature, so you may not get treatment for it right away because you may not recognize it as something other than the flu. And it's a pretty resilient virus. It can survive on environmental surfaces at room temperature for up to a week. So it can survive even in dry blood. And there are medications available, but they only work in some people. There are vaccinations available for hepatitis B. So if you've had vaccinations, and it's a series of 3 shots that you go through, and all of you should have had that offered to you as an employee of the agency. But if you've gone through the vaccinations and you've got antibodies built up in your system, then you're virtually immune to it. It's not as big of a risk if you've been vaccinated. Hepatitis C is very similar to hepatitis B. It's a different viral strain. It does a lot of the same things. It attacks the liver. And again, left untreated, it can cause chronic liver disease. It can lead to liver cancer. It can cause death. It can be fatal in severe cases. The differences between hepatitis B and C is hepatitis C is less common, and it is more deadly if you do contract it because there's no vaccination for hepatitis C. There have been recent medications that offer improved suppression of hepatitis C, but there's no cure per se for it. It's the leading cause of liver transplants in the United States. So if you get hepatitis C, it's a very deadly viral infection. And then HIV, which I'm sure you've all heard of, is of course viral. And of course the big risk with HIV is that it causes AIDS, which attacks the immune system, destroys the body's ability to fight even minor infections. So it becomes fatal eventually. HIV is much more fragile than hepatitis. It can only survive away from the body if it's in bodily fluids or if it's in laboratory conditions, so it's very fragile. The big risk with HIV is that once you're infected, you can look and feel normal, not have any symptoms for years without identifying those. So you may pass it along to other folks without knowing that you're doing so. There has been a lot of improvement in the suppression of HIV, but there's ultimately no cure. If you get to the point that your HIV develops into AIDS, then the likelihood is that it's going to be fatal. And again, treatment has improved, but there's no cure yet. So prevention's the best tool for HIV. All right. So the way that we get exposed to pathogen, we reviewed this just a little bit before, but you have broken skin, you have mucous membranes, things like the eyes, nose, ear, mouth, sexual organs that can allow pathogens into the body. And there's 2 types of transmission. There's direct transmission, where you have direct transmission with contaminated blood or bodily fluids. You have unprotected sex, you get stuck with a needle or some other shark that has blood, infected blood on it, or through indirect transmission. So you come into contact with a rag or a towel that's been used to clean up a blood spill. You don't use the proper protective equipment, and you have an open sore on your hand, and it gets in through the contact with the towel. So hepatitis B, hepatitis C, HIV all share common modes of transmission. The risk does differ. I mentioned this before, but hepatitis B, if you've gone through the vaccination and you've got antibodies built up, very low level of risk that you're going to contract hepatitis B. If you're unvaccinated and you have a needle stick or some other direct exposure to contaminated blood, then your risk of of contracting hepatitis B is as high as 30%. Your risk of getting hepatitis C is about 2%, and your risk of getting HIV is just under 1%. So the risk, if you're unvaccinated, is greatest for hepatitis B. Not that it's the most deadly, but it's the most likely pathogen that you're going to contract if you don't have the vaccination.